So hello everyone and welcome to our session on engaging partners with behavioral science, one of the final sessions of UN Behavioral Science Week 2024. So my name is Mary. I'll be moderating today's session. I lead behavioral science in Secretary General's office and also lead the UN Behavioral Science group. So with us today, we have a number of interesting panelists to speak about their experiences working with the UN and outside and how they apply behavioral science. But before we do that, I'll just say a few words about Behavioral Science Week. So we're bringing together 38 UN entities, the biggest behavioral science week yet. There still are a few more sessions today. There's one coming after this one on health, as well as one to close us out on technology and sexual harassment. So that would be an interesting one. Actually, in the last session, we'll be featuring a video from the Deputy Secretary General closing out Behavioral Science Week. So if you want to attend that one, that could be a space to see her remarks. But back to today's session. So what we'll do, as I said, we'll hear from our panelists, and then after that, there'll be a lot of time for questions, for Q&A with them. So I encourage you to put your questions in the Q&A box. You can also upvote the questions of your colleagues in the box as well. So, so check out the Q&A box and put them there. We will not be taking questions from the chat. So don't put your questions there. They will not be answered. Find the Q&A box and put them there. Okay, so with that, on to our speakers for today. So we're going to be hearing from 3 organizations. First, we'll hear from FAO. We'll hear about some of the experiences of Julia Haman and Diletta Tapazio regarding their experience within FAO and engaging with different partners. Then we'll hear from colleagues in UNICEF, Ukasha, we mixed 2 of your names there, Ukasha Ramli, as well as Khurshid Zafari from UNICEF, from the government of Uzbekistan. And then finally, we'll hear from Tim Chadbourne and Julian Onoko from the WHO to talk about their experiences at the more global level, reflecting upon behavioral science as well. So with that, I'll stop screen sharing and turn it over to Julia. Oh, we can't hear you, Julia. I think you're muted.
Okay, great. Thank you for the warm introduction, Mary, and excited to get us started with FAO's work on engaging partners with behavioral science. I'll share my screen so that you can follow the presentation. Yeah, working with partners, we've engaged with the Regional Decision Lab in Kenya through the regional office there, and we had 2 experiments that actually tested behavioral science on the ground. And just to say, we could have never done it without the partners, because if you run experiments or behavioral science interventions, it's very important to contextualize them. So here you can see an experiment that is trying to understand decision-making of smallholder farmers in relation to changing weather conditions and their crop choice. And what we found is, if we in the experiment use crops or pictures of crops that are not from that region, the farmers might not really understand the question correctly, or might not really relate to the content as if the pictures were from the region and taken from the ground. So we engage with the extension officers to really collect the right pieces of information in the lab, in the field environment, so that they can work together on the implementation of the experiment then when we engage with the farmers. And also it was a great way for community entry as well, because all the trusted relationships that they had with the farmers in their region would have also never been possible if we wouldn't have worked through very strong partnerships there. So I think for contextualization in behavioral science, partnerships are very important to create the trust environment, but also to create the nuanced data on the contextualization. And another example, once you're past the experimental stage of behavioral science and you're trying to implement a behavioral intervention, again, here it's very important as well to involve different perspectives and strong partnerships to really enable the co-creation process for behavioral science to have different perspectives that inform the intervention design. So here you can see the pilot that we've done in Mozambique in one of the slaughterhouses, and we have involved traders and vendors, but also the local ministry and government to support us in the first of all identification of the slaughterhouses, but then also in the co-creation of the solutions, really understanding where the issues are when it comes to biosecurity and understanding the current conditions in which they're working. So you can see a picture here on the left that kind of outlines the slaughter process that they've drawn on, and we then identified the clean areas and the dirty areas, and with an intervention on using colors. it was then possible to differentiate clean and dirty areas. And then the colors, for example, were again contextualized to link it to the previous slide, because for me, red is blood, but is that the same for someone in a different context, right? And also understanding, okay, then a chicken might be pink or yellow, depending on the context in which we are operating in. So again, very strong need here for partnerships to even be able to do behavioral science on the ground, to be able to create intervention designs that are supportive of the local conditions and context. And Diletta, I'm handing over to you because I'm sure you have things to add to this, also running a lot of lab in the field experiments.
Thank you, Julia. I hope you can all hear me well because there was an audio connection issue recently. So yes, so let me show you a couple of other examples where collaboration and engagement and coordination with partnerships was fundamental part of a field experiment design. For example, I'm thinking about an experiment we are about to run in Tanzania, where basically we had the necessity to engage with other partnership there for a proactive and mutual learning. Indeed, the case was that we needed a randomized sample to get a good picture of the population. And of course, it's not easy to follow from the headquarters such a procedure. Therefore, we needed to proactively learn from other partners to find the right sample. As a good sample, it's necessary to get a good evidence and a good data analysis. This was the first example I wanted to mention, but also another one which happened while designing a field experiment in Nepal. And here the idea is that we wanted to elicit the discounting preferences. So we wanted to use a very behavioral approach to explain the decision-making of farmers. And here the idea was to use the usual discounting elicitation procedures, where you basically have to choose either €100 today or maybe €105 tomorrow to understand which are the discounting preferences. But of course, here the question is, what's the meaning of €100 for a farmer in Nepal? And of course, to understand what could be the equivalent of €100 for a Nepalese farmer, we have to talk and discuss and engage with partners, with other entities working there, to learn from them and to include this new knowledge into our existing knowledge. That's another example where coordination and a proactive attitude and sharing was fundamental for the success of a field experiment. That's it from my side, and in case you have questions, we can then address them later on. Thank you.
Great. Thank you for that, Diletta and Julia, your reflections on working in the fields with different partners. We can unpack some more of those, I think, in the Q&A, reflecting on what it's like to actually do these projects and some of them, maybe the successes and the challenges and the criteria of how are you able to do this. Okay, so next, if you want to stop screen sharing, Julia, we can go on to our next presentation. Thank you. So over to Kash and Khurshid from UNICEF and Government of Uzbekistan.
Thank you, Mary. All right, so today we're going to, from UNICEF's perspective, one of the areas of partnerships that we work on is in working in collaboration with local governments. So one of UNICEF's approach to growing behavioral science is to support local governments and institutions to run their own behavioral science projects by developing a behavioral science unit. So from our perspective, the benefits to behavioral science for this occurs in two ways. So firstly, it helps to generate ideas, insights, and solutions from a wider and disparate range of contexts and cultures. And on the other side, it helps to reaffirm the insights that we already have by testing them in these different contexts and different policy areas. So we were first approached by Khurshid from the government of Uzbekistan to support them in setting up the unit. So this was entirely their own drive, which is fantastic to always encounter. This wouldn't have happened without our colleagues in the Uzbekistan country office and regional office, so Dilfuze and Sergio. So the steps that we generally take for some of these is to identify the available capacity of people already working in the government and then seeing what needs to be supplemented by additional recruitment. we identify the location of the unit. So I'm just going to quickly share my slide to show this. Cool. Yeah, so as you can see here, yeah, so we, oops, okay. Yeah, so we identified the location of where the unit sits. So this is an example from the government of Uzbekistan, where you had the Institute for Social Protection and Development, and then the Department of Strategic Analysis, which is kind of where the institute is kind of like a local think tank where Khurshid leads. And so they kind of provide the research function of that, and they call upon the different departments of the government for additional functions and resources. So, for example, the press services provide the engagement and design components of behavioral science, whereas the Department of Strategic Analysis helps Khurshid and his team to then influence policy, but also it feeds back to them by understanding what are the policy priorities within the government and what are the opportunities that they can work in. Yeah, so I'll now pass it to my colleague Khurshid to describe what inspired him to approach us in the first place. Over to you, Khurshid.
Thank you very much, Kash. Yeah, my name is Khurshid. As Kash also said, that I'm director for a think tank under the National Agency for Social Protection in Uzbekistan. The agency is very new. It was established last year. I was invited to lead the strategic analysis unit within this agency. Before the creation of the agency, the social protection system was scattered across different ministries, and which also led to inefficient delivery of social protection programs. And when we analyzed the social protection schemes, we came across to different and various errors. Both inclusion and exclusion errors, and most of them was the result of a big share of informality in Uzbek economy. So our first reaction was to improve digitalization, and by digitalization reach those who are deprived of social protection schemes, and to better target our policies. But digitalization is not a silver bullet. It cannot capture what's not capturable. And as the agency was very new, we had very good window of opportunity to pitch the idea of establishing behavioral insight unit within the state agency. Before that, and even now, not a single ministry in Uzbekistan has this behavioral insight unit. So we pitched to the management the beauty of behavioral science and how it can tackle complex issues in a cost-effective manner. The management supported the idea, and then we approached UNICEF because UNICEF has its own social behavioral change expert within the country office. We asked if they can support us. And then the group of international experts visited on scoping mission in Uzbekistan to identify potential areas, identify potential stakeholders who can spearhead this new method. And this is the result of that scoping mission, and three main actors were identified, and now we are working with UNICEF experts, with Kash, on improving the targetedness of our policies. For example, how we can reach people with disability who do not have status of disability. For example, only 2.5% of population has some kind of disability, which is statistically very low. According to statistical probability, there should be at least 15% of such people. So that indicates to like social norms, stigmatization, or other things. Therefore, we want to target those social norms via these behavioral interventions. And we are designing our first policy interventions this June. I'm very excited towards that workshop, and thank you very much for listening. Over from my side.
Thank you. Back to you, Mary.
Thank you, Kash and Kirshan. Really interesting examples there about how you're able to do this at the government level, at the member state level. Thank you for that. Next, we're on to our next speaker. Tim's eagerly joined us already. WHO, Tim and Julianne, would you like to, over to you.
Thank you, Mary, and thank you, everybody. Good afternoon, good morning, good evening. So I'm Tim Chaborn, and I'm speaking with Julianne, who's from the WHO Office for the African region. I'm here at the headquarters in Geneva, the WHO. And while WHO works across 3 levels of country offices, regional offices, and the headquarters, we work across all levels from sort of working locally with member states. But today we're going to change tack and talk to you a little bit about how we engage with member states across the regions and across the world. So firstly, I'm just going to talk a little bit about how we engage with member states to develop the global resolution on behavioral sciences for better health. And I'm just going to share the screen. And then Julianne's going to talk about supporting member states to mainstream behavioral science in a regional strategy for community engagement in the African region. So first you might ask, what is a global resolution on behavioral science? What's the point of that? What does it mean? How does it come about? So it's a document developed by global consensus, and it acknowledges the value and need for behavioral science and public health. And it sort of has priority actions that member states and WHO are urged to take to realize those benefits and improve public health outcomes across the world. It acknowledges achievements and previous statements.
Sorry to interrupt you.
Sorry.
Hi, Tim. Sorry, are we supposed to see slides? Because we're seeing the background of your screen, but not the slides.
Okay, so sorry. That's picked up the wrong. Thank you for that. Can you see it now? We work when we practice.
Yes, there is. WHO Behavioral Insights Unit. Thank you.
It worked when we practiced. So yes, you can see some of the detail on the screen. Just to say that in a global resolution like this, it has 3 kind of major components. The first is acknowledging some of those previous achievements and common understandings and factors that really provide a foundation for behavioral science and public health. But maybe the 2 key actionable parts is one section which has priority actions for member states. That includes identifying opportunities to use behavioral science, establishing behavioral science units and strategy, and developing human and financial resources for behavioral science. There's also a component around the requests for WHO, and they include mainstreaming behavioral science within WHO, establishing a global repository of behavioral science evidence, compiling and disseminating evidence on improved outcomes, and providing behavioral science technical assistance, guidance, capacity building, and knowledge sharing. So that's what it is. And what it really gives us is a global consensus on the agenda for the use of behavioral science. It gives us formal commitment on priority objectives to achieve, and also a costing and timeline for delivery. And that's really important in terms of the clear expression of political will to guide action. So how does it come about? You can see a little bit of a timeline there on the slide. In April 2022, the WHO Director General presented a report on behavioral science to the World Health Assembly. And that was followed by a strategic roundtable led by the Director General, in which Malaysia proposed a resolution and co-sponsors supported. So this is like forums where member states come together to discuss and agree on what their priorities are and how to take them forward. In August 2022, Malaysia created an initial draft with input from co-sponsors and support from WHO. And then through to December and January 23, were 5 consultations globally with member states, and WHO provides a secretariat role for those consultations. In February 2023, the resolution was tabled and passed at the Executive Board of select member states. So it's a subgroup of member states. And then in May 23, it goes to the World Health Assembly and it's adopted there with 18 other states as co-sponsors and adoption by all of the states across the world. So WHO's role is really secretariat, convening, scribing, gathering and preparing background information. And it's important to note that often in these delegations, they're representatives of the ministries and not necessarily public health technical experts. So the convening and secretariat role is quite a valuable role to play. The member states obviously contribute background documents, the charters, UN publications that the resolution builds on. They contribute draft text. They discuss the importance of different perspectives and how these could be interpreted, and agree on priorities and develop the consensus. So what's really key is that from 2022 onwards, we've been able to then mainstream behavioural science into regional strategies, as Julian will speak to. For example, in the European region, WHO European region of 53 states, they have co-developed a regional resolution to adopt a framework for behavioural and cultural insights with 5 strategic commitments and a progress model for regular country reporting on activities. And the Western Pacific region has embedded behavioural science into the regional action framework on communication for health. So from 2023 onwards, we're delivering a capacity building program, developing normative documents, technical assistance, and all those things that have been requested from member states. And we now in 2024 have in WHO a 5-year global program of work, which includes behavioural insights in the response to the resolution. And we're moving forward in a consultation with member states on their requirements for implementation and evaluation. And we'll be reporting, the first reporting milestone is the World Health Assembly 2025 next year. Thank you for that, and over to Julianne.
Thank you very much, Tim. Good afternoon. Please, can you share my slide? Thank you very much. So thank you very much. What I would like is really to explain to you how in the Afro region, we mainstream the behavioral science into the regional strategy for community engagement 2023 to 2030. So in 2024, we started the engagement of the countries. We started listening to countries, and countries, they made in-country assessment with member states on risk communication and community engagement. And in 2022, we organized a workshop with WHO country offices, and we brought on board something like 18 WHO country offices to discuss really how we can develop the community engagement regional strategy together, which one of the objectives is really behavioral science. So in June 2023, the program subcommittee reviewed the strategy, the draft of the strategy with some few member states, and they agreed that the strategy has to be adopted during the regional committee in Botswana in 2023. And they highlighted the importance of really listening to our communities, but also push member states to listen to the communities and to conduct the research, the behavioral science research, in order to really reorient their own strategy, focusing on behavioral science. So where are we today? When we started listening to the countries and they share with us what they were expecting from WHO Afro, I want to remember you that WHO Afro is composed of 47 countries. So those 47 countries are the ones who really adopted the community engagement regional strategy, which third strategy is based on the behavioral science and the research. So what member state highlighted, they highlighted the need to mainstream behavioral insights for all health emergencies, universal healthcare, primary healthcare, and sustainable development goals. They asked us to enhance data collection, analysis, and reporting capability, also improve community feedback and stakeholder involvement. And for WHO, what we have to do is to use behavioral science to help achieve these goals and provide technical support to improve the rigor and documenting and gathering the evidence. Our main strength is how we listen to countries. This is the main strength. We listen to countries really by starting meetings with them, buying in the behavioral science. So we work with the Minister of Health through the WHO country office, and we had meetings where we listen to them, we buy in the behavioral science, and after that we start the interactive relationship up to the implementation of the behavioral science in each country. We also provide countries with technical support and also with financial support to implement the behavioral science. We also support countries when they have to engage research institutions like universities or individual experts, and we provide this technical assistance to them to be ensured that the research institution really understand the priorities of the country in terms of behavioral science. So I think that I will stop here. If I wanted to share an example, I don't know if I have 30 seconds. Is it possible to share an example?
Sure, Julianne, you can speak for 30
Yes.
seconds. That's all right. Go for it.
Thank you. Thank you very much. So one of the examples I would like to share is the example of Zambia and Nigeria, where we implement the behavioral science strategies. We developed with them a tool. We also implement this tool, the research tool that I will share in the link online. And in Zambia, what I can say is that Zambia has the ethical committee. So each research that you have to do, each behavioral research that you have to do in Zambia, first, your research protocol should be taken to the communities for socializations. All your questionnaires should be translated into the local languages, and the communities to have to validate your research protocol, and you translate it in their own languages. So they will hold focus group meetings, community dialogues to socialize the tools of the research. And after that, only after the report, the positive report from the communities that they have understood and their knowledge are taken into account and their perception are taken into account, and they understand very well the research, that the ethical community will give you the ethical approval to conduct the research. So thank you very much. If you have any question, I'm very happy to answer. Thank you. Over.
Great. Thank you, Julianne and Tim, for a really concise, a lot of work went into that, but you've been able to condense it into just a few minutes. Thank you. And yes, there are some questions for you, Julianne and Tim, so we'll get to those shortly. But for now, why don't we have everyone turn their cameras on? We have quite a bit of time for Q&A, and also it'd be great to have you discuss with each other. So I'll pose the questions that might be to FAO, maybe to WHO, but also reflect. It'd also be nice to hear from your diverse experiences in this space. Diletta, you might be here with us, maybe not, but feel free to turn your camera on or not. Okay, so we have some questions. I'll go with a few for each of you. So for FAO, FAO, you've already answered a few of them. But there are questions around challenges getting buy-in for behavioral science. You know, what are your general, how do you approach that at the more project level? How do you convince partners or demonstrate the value of behavioral science at that level? Also questions about what makes a good behavioral science project partner. I feel like that's one that probably many people have, of what kind of criteria might you look for in running a project, because you know, a lot of effort and time goes into applying behavioral science. Not every project is necessarily a behavioral science project. Also some questions around sharing your experiences, another one, a project partner. And then there's another one here for you on what specific behaviors you're hoping to understand in your study. So you outlined the example you gave, maybe just going back to what was the specific behavior you spoke to in your study for some clarity there. Okay, so over to you and Diletta on some of those big behavioral science questions.
Yeah, I think Diletta and I can only talk for our very limited experience in the field for now, but what we found in terms of getting government buy-in or engaging with local communities at the ministry levels, it was very not that hard. I think they were very open to the idea of trying something new and being innovative, and we involved them very early on in the process as well, where we briefed them about what we wanted to do, where we seek feedback from how we can do it better, where we had a lot of conversations around, the co-design workshop, and also meeting them in person before hosting it. So I think it's about creating relationships with those partners first and foremost, but I'm sure that it's nothing new for any one of you, that that's an important part of partnerships, that there is a constant dialogue going on. To answer the second question, what you're looking for in a behavioral science partner, I think there it's very important to highlight that ideally this partner would have experience in the country or in the context in which you want to try to implement a behavioral science experience or approach. And I think the local presence here could very much, be that they've either run an experiment there or that they have people working on the ground. So that's very important. And I think if you engage with a partner, ask them about their behavioral science methodology and whether that's rigorous, because there's a lot of behavioral science approaches that are not rigorous, but that could also benefit your project if they're around human-centered design or something a bit more playful. A playful way of, for example, collecting data is also a great way to get started on behavioral science. So it's not necessarily wrong, but if you want to run an experiment, for example, the methodology should be a little rigorous, even if applied. And then the last part, maybe it's about innovation and participatory data collection methods that go beyond just the user survey design. I think is a very important part, because if you're just asking another survey, it can very much turn into behavioral assessment that then is very hard to get started on. So if you work with the partners, maybe think about focus group discussions or something a bit more applied in the space. And on the last question of what behaviors we were looking to influence or which we were looking to understand, the first study was around understanding farmers' decision-making in changing weather conditions in relation to crop choices. So there we tried to simulate certain weather conditions and have them answer to it through their decision-making in the experiment. And then the second one on the slaughterhouses was that there was a very long protocol on biosecurity measures that were not implemented in the open-air slaughterhouses. And we tried to find a way through co-design to make it more easy for the traders and slaughterers to follow through on some of those very complex high-level biosecurity measures that were agreed on a global level. I don't know, Diletta, if you also want to talk to any of those that I just answered, especially I think on the experimental design, there's maybe some other things that you're looking at the moment.
Thank you, Julia. I think that you mostly addressed all the feedbacks and comments that I wanted to address as well. And let me just say that indeed, the main idea is to include, our theoretical knowledge and what we can design from headquarters is of course limited because of field experiments and lab experiments on field and on LME countries, of course, need a specific knowledge of the context there, of the behavioral specific characteristics of the sample. So that's why I think collaboration and engagement with partnership is specifically fundamental. And then, of course, I agree with all the points that you mentioned. I think that your replies were very much comprehensive. So I agree totally with you.
Great, thanks, Julia and Diletta. Maybe we have some people on our panel who don't agree. I don't know if any has any other thoughts or ideas. I'm sure this is all great what you're saying. It's behavioral science. For one thing, I'll just maybe make a comment here as moderator. I'll say something in terms of running behavioral science projects. I agree with you all with what you're saying. I think one thing, especially colleagues in the UN are new to behavioral science. They might not have experience with field experiments or studies or even, as you could say, quote, rigorous research. So then, how do we work with these colleagues as well? So I think one thing that we often reflect upon is people who are really committed and really wanting to do behavioral science. Like when Kirsten was speaking, I was thinking about, he just seems so interested and committed to behavioral science. I think finding those types of partners who are willing to work with us in the UN, that general just commitment to understanding and doing it is also one thing. But I don't know, Tim, Kirsten, Julianne, do you have thoughts on how to find, I know this is not your part of your presentation, but maybe some thoughts on working with partners on the ground. What do you think are good partners? What makes good criteria for you? The more micro level.
I'm happy to come in
sure.
a little bit if that's useful. And I think maybe it links to one of the questions there around what type of governments are more into behavioral science as well. I think because it's fascinating, really. I think there's a lot of interest, obviously. To have a global resolution where every country demonstrates, signs up to it, and they have like lots of them kind of co-sponsoring a resolution. There's obviously, and we know there's a kind of a wave of interest at the moment, and over the last sort of 5-10 years around behavioral science. So I think that sort of internal motivation they have themselves. Kash and Kirsten talked about it themselves in terms of Uzbekistan. If the country or the partner at whichever level has an interest and sees potential, but often I feel like they're looking for some expertise and some support, right? So that's where we can come in and provide some help, linked to technical assistance, whether it's what we can provide ourselves, or as Julian was saying, we can link through to external partners, universities, etc. And as we do that and we sort of deliver projects with our partners, I think they learn to see the value and they can see the contribution it makes. So it's bringing in a different perspective to traditional, maybe not traditional ways of thinking, but the ways of thinking that they have within their existing teams. Just bringing a different perspective, and that's always valuable. And sort of demonstration of the effect is really powerful. And there's so many different sort of case studies and examples that we have that we can share now.
Great, thanks for that, Tim. At the more macro level, I think there's a lot there to unpack. I don't know, Kash or Khurshid, we'll get to some questions for you dedicated to your presentation. Do you have any thoughts on kind of engaging with partners more generally? Yeah, Julian, please come in. Oh,
Yes. For us, it is really very easy to engage with partners and with government because, the African region, we have each year something like 141 health events between outbreaks, humanitarian crises, security problems, and so on. And in Africa, all those outbreaks starts in the community, in the family, in the household. So it has been very easy for us to buy in this behavioral science approach, explaining to the government the importance of knowing their people, collecting the information, analyzing the data, and we demonstrate to them that when you use the behavioral science data, you can reorient your strategy, but you have also to take this data and this knowledge back to the communities and discuss this with them if we have to work in terms of change, So it's really easy. We are really overwhelmed with the requests from the countries, and our team is a very small team. So now we are trying to bring people on board so that we can really answer to the several requests that we have from countries. I also see a question or a comment one person said that they are really happy to see that BI and RCCE teams are working together. I would like to say to you that at WHO, BI and RCCE, we are the same team. We are not a separated team. In Afro, for example, our RCCE team, we have one BI expert, which role is only BI, behavioral science. And we have RCCE, infodemic, anthropologist, journalist. So it is a small team, but we are a complete team. So what behavioral science colleague is doing, we do it together. Now they are training in Tanzania and in Namibia next week on BI. We are working together and we use what behavioral science do. We use it to develop the RCC strategies and reinforce the community engagement. Thank you, and over.
Great, thank you for that, Julian. I think it underscores another theme that's been coming up throughout Behavioral Science Week of just different partners working with us, whether they're economists or public health specialists or communication specialists, they're all part of when we apply behavioral science as well. Okay, so over to Kash and Khurshid. Do you have thoughts on these questions on working with partners? And I also have some other questions dedicated to you in the chat, but on working with partners more generally, do you have some ideas on some criteria maybe you look for?
I'll let Khurshid go first.
So I'll answer from the partner side then.
Please.
So I think one of the values of behavioral science is that it can deliver results without big expenses, and that was the mainly the reason how we solved the idea of establishing a behavioral insight unit in Uzbekistan. For example, if we talk in numbers, more than 2 million families received social benefits in the last year, and the total sum of expenditures was close to $1 billion US. And but 18% of families who were entitled for this benefits were incorrectly assigned. Like there was an inclusion error, 18%. So it was very convincing to say that, look, almost $200 million is being used improperly. Of course, we can do some better policies, better integrate with other databases, but what if we can also integrate this behavioral insight principles? It doesn't cost much, but potentially it can bring value disproportionately high. And with a simple methods, we can improve our targeted approach. So that was the idea. I'm not saying that the government is now convinced, because we haven't seen the results yet. But they're expecting. If we can prove that on this example that it is still it is a working mechanism, then I bet that there will be more interventions, not only within the within the social protection system, but also in other areas. Thank you.
Cash,
just to comment on that, I guess, in terms of identifying partners, but I think I'd like to give credit to like all the behavioral scientists that spent the first half of their career kind of selling behavioral science to governments, to companies, to various institutions. And this was the Trojan horse that we had, right? This was the same with BIT setting up with the UK government and everything. It was the quick, easy wins. And I think this touches on one of the other questions. And the thing is like, how do you select which policies? And it's like, it's the one that's low hanging. It's the one that's cheap, but can be quite impactful and can demonstrate that behavioral science can pay for itself. And it's people that have been exposed to that are then become the people that approaches the most to form partnerships. So yeah, so a lot of it is to do with all the sales that was implemented by behavioral scientists all around the world for the first half of all our careers. Thanks.
Great, thanks for that, Cash. I think, yeah, it's a different landscape now compared to 10 years ago. But I think also too, maybe just to add something to this conversation. I know it's not easy when you start a behavioral science unit or team. I've been a part of some of the early stages of a number of them. But one strategy we took, we had maybe a bit more space, and different teams I've been a part of, has been, we do the easy wins, the ones that we know will work, kind of cost effective, all of that. But we also try to choose a product that's a bit more, let's say, maybe not in that category, to just demonstrate that behavioral science can do more than that as well, because we purposely don't use the word nudging. And a lot of these we use behavioral science. There's a lot of tools in our toolkit now, as you mentioned, we're doing this for 10, 15 years almost, I guess, in practice. So there's a lot we can be doing as well. So yes, agree on the quick wins, but maybe there's also some scope for more, not to trying to create some debate. I agree with all of you. We're all behavioral scientists. We're just trying to push back a little bit.
No, definitely. But that's, sorry, just to respond to that. But that's the point. It's that we've had to use nudges as a way in, as a way to like capture the world's attention and win entry point. But then now that we've been established, we're able to expand on it and work in the other areas, and also expand on the methodologies that we use, so that we can actually make differences on a systemic level.
I knew you would agree with me, Cash. I just there's clarity. Okay, great. So we're on the same page. Now some more questions for you and Khurshid, because I think we've answered some of them kind of a little bit, but I think it's important to note, because there are probably some colleagues here with us from member states and maybe thinking about how they can apply behavioral science in their work. So you mentioned a bit about how you convinced the ministry, Khurshid, but what are your thoughts on generally when we should form teams or units, or when we should embed behavioral science and maybe in certain parts of the organization, maybe more generally on that? How do you think organizationally about this? And then also, how do you choose projects? You kind of talked about the quick wins, but Khurshid, you mentioned some of the areas in social security, and are there certain spaces you see behavioral science maybe more applicable when you're starting out or versus others? So yeah, some thoughts on, to those questions. Over to you.
Thank you. Basically, as Kash said, that from the first choice could be the quick wins, but in our case, we are choosing not very comfortable one, but the project that can potentially bring great value for the same efforts, and we have a very good window of opportunity. Window for experimenting. Like in July, we are launching a new formula for identifying low-income families that will be piloted in several districts, and therefore we want to pilot not only the new formula but also behavioral science, and we will see combinations. So we will see how the new formula works well with the behavioral science, or other way around. And also, in my sense, that if there was a ministry that has been operating for long, that was be nearly impossible to integrate the new principles in their work, because the government structure is very, say, conservative, and it's very difficult to change the structure, organizational chart of the ministries. In our case, we were lucky because the agency was very new, and there was still room for innovation, room for something, some novelty, and therefore it was easy for us to pitch the idea. And when we are talking to other ministries, they still think that it's not a real, really applicable in Uzbekistan's context. But as I said, now we have to prove in our first examples that it is it can be applicable, it's feasible. So, if I answered to your questions.
Yeah, no, you did. I think it was really interesting how you spoke about kind of the moment of this, right? Like it's oftentimes when these units and teams and initiatives generally are formed, there's usually a moment. And you spoke about with the ministry there, you had this moment to do that. It's new, it's open to innovation and ideas, and taking and using that to the ability to apply behavioral science. I think that's really interesting. Kash, do you have any more thoughts, or should we? No, you're good. Okay, thank you, Gosha, for that. So any other comments from colleagues on this question about how to choose projects when you start, or when maybe organizations should form initiatives or when they shouldn't form initiatives? Colleagues from WHO, FAO, any thoughts on those ideas? No, that's fine as well. We have many more questions to get to.
I can chip in quickly.
Sure.
I mean, but some of these things are generic. You know, I mean, good planning and good sort of motivation, engagement of stakeholders. You know, these are required for many, many projects. I guess the question is like, what's different about a behavioral science project? So being really clear about what is the added value of behavioral science, and what's, as we all do, like, who are the actors in the system whose behavior need to change? Like, we come in from that perspective and bring that really clearly, and thinking about how that is taken through the project. So it's not sort of a tick box, but it's a core part of whatever we're doing. I think is key.
All right, thanks for that. Nothing else? No comments on those questions? Okay, so we have a few more questions going back to WHO and your work. So there's a few here around for Tim and Julianne, which, in terms of the global framework and how you're working, which types of governments do you think are more into behavioral science in terms of the global framework that you have? What do you see any criteria around those who are more amenable versus not? So it kind of picks up on the previous question, but perhaps in the more global, you know, the discussions that you're having, are there certain things you can see with those? And then another question for you about what's the most effective approach you found for getting behavioral science partnerships to recognize our behavioral science kind of values? We already touched upon that a little bit, but maybe if you want to expand on that some more. And then I think you may have answered a few of the other ones there. If you have, feel free to comment on other questions that you have for you. But Julianne and Tim, over to you for some of the larger questions related to your work.
Julianne, do you want to start?
Yes, thank you. Talking about governments, we don't have, I can say that we have some government we are really against or favorable to behavioral science. It's a matter of taking them to understand the importance of behavioral science. And when we do it, it's always work. We have in several countries. Now, I told you we are now training in behavioral science in Tanzania. We will train in Malawi next week, but it is a request from the national counterpart, from government, that they used to send a request to WHO country office, and the WHO country office will send the request at WHO regional level, and we are going to support them. So we can't say that we have those who are supporting or are against. No, it's just a matter of working together. For us also, using behavioral science is a game change for us at WHO regional level, because it pushes us to better listen to the countries and to the governments. And so we take the technical expertise, we buy in the behavioral science, and we never had a refusal from any government when we do it really in the respect of their procedures and also the respect of their interest, and we sell it with humility also, and technical expertise, of course. Thank you.
A fantastic response. I mean, I just was trying to reflect on the question, what type of government? So I was trying to think, what are the ways in which we kind of think about types of governments? I didn't know if the question was more about sort of political leanings of governments, if that was the question. But I think we have governments of all shapes and sizes, different political leanings, all interested in behavioral science. As I mentioned, you know, across many different regions, we've got sort of engagement at the regional strategy level, and then with the global resolution, we have engagement and support for more countries at the global level. So I think it's almost kind of saying, well, would a government not want to use economics in its approach? That would be a little bit strange, right? Would a government not want to use a kind of clinical expertise on health in its approach to health? I mean, I think it's one of those fundamental things that people are realizing has been underutilized. And they see as I mentioned before, they sort of see the practice in the private sector, public sector in different areas. And so I think, as other people have said, there's often a demand, an ask for us to support. There are definitely local champions, and I think within different governments, they could be in different positions within the government, and there can be different sort of barriers to them. As Kirsty said, I think there's a little bit of the process of kind of exploring where does the support come from and how do you get that buy-in. I think that's really key. But yeah, it's really, I mean, it's great when we have a high level support within the government who really sees the value and wants to make a difference.
Great, thanks for that. Oh, sorry, go ahead.
No, I don't know, because you mentioned some of the other questions. I was in the process of sort of typing the answer to one of them about the most effective approach. Is one of the other ones you highlighted. One of the most effective approach for getting non-behavioral science partners or organizations to recognize where behavioral science can add value. And I think we always try to take, I was trying to write, but I've got halfway through. We always try and take a behavioral science sort of informed approach to it ourselves, right? This is a kind of problem if someone wants to do something differently. Someone wants to use behavioral science in their work. Let's try and think about what are the barriers, how can we help? So I think we come with that. I mean, Julian put it in terms of humility, and that's a great word to use, but come in terms of listening to their problem, doing some research on their issue, thinking about what are their objectives and what are some of their barriers, what's going to help them, what are their enablers, how can we help, sharing some of those examples from other countries, being aware of the constructive competition that might exist between countries or partners. You know, people are keen to do things. So be aware of people's motivations and bring that sort of behavioral science perspective. And in our area, that's kind of hopefully very complementary to the clinical and epidemiological disciplines and that often contribute to public health problems. So we're bringing hopefully something new and with added value.
Yeah, those are nice summary remarks of how we're working with partners and to really apply behavioral science with humility, but as long as the technical expertise, finding these champions that can work with us, and also looking at different angles we've kind of talked about today here, of like whether it's an innovation angle or a research angle or a cost effectiveness angle, depending on who you're speaking to. Obviously, you have a different value add of behavioral science. So lots there to unpack. But I think we have only a couple minutes left. Does anybody want to have anything else to say on this topic, whether it's working with different partners, which types of governments might be more amenable to behavioral science or partners? If not, there's another question for Julianne I can ask her, but if anyone wants to comment on that. Not, I think you're answering it already, but you can answer it live like Julianne. The question is a bit more around, you talked about the community engagement and sort of our traditional community engagement, and then the behavioral science side, and just articulating a bit more the behavioral science value add to the community engagement. How are you more just generally reflecting upon adding behavioral science to the work that you do?
Yeah, I think that when we use behavioral science, first we need to understand the context of the people who we pretend to help, or to partner with. And we used to do it if we do the research. For the research, we have to sit down with the people. So we work together in understanding their context, also validating the result from the research, and discussing together how we are going to implement the research. So this push us really to take our time, not to think about what we want to do as organization, but to apply the bottom-up approach, putting the people in the middle of all our intervention, giving them the floor, listening to them, collecting their knowledge, and giving values to what they know and what they are really willing to share with us. So this is all what we do when we have to integrate behavioral science. So once we have the research, we reorient all the community engagement strategy, because the strategy are then fitting with the community's expectancies. The strategy of responding to their worries, because we build this together and we use what they say, we use the knowledge to reorient those strategies. When we have, for example, to develop messages, we never develop messages by ourselves. We use the knowledge from the behavioral science to develop the messages and to respond to the infodemic, to rumors, to build all the community engagement strategy. Behavioral science is really critical, and now it is not possible for us in the Afro region to do anything for community engagement without starting by behavioral science knowledge collection. Thank you, and over.
Great, thank you for that, Julia, and just to articulate very clearly how you do this and some of the fundamental aspects of the work that you do. Thank you. So with that, I think we've reached time. We're at our time for our session today. If anyone doesn't have any other comments or suggestions, ideas, reflections, no? Okay, with that, then maybe we'll close it out for today. Thank you very much for this conversation. Very diverse opinions from the UN as well as outside about how we apply behavioral science with partners. So as we mentioned, well, thank you to our panel and thank you to the audience for joining us today. So as I mentioned, we have 2 more sessions for Behavioral Science Week. One's happening just an hour from now on health. Check that one out. The UNICEF will be there, WHO will be there as well, along with the UNAIDS. And yeah, keep in touch and join the behavioral science group as we go forward applying behavioral science across the UN. Thanks, everyone.
Thank you so much.
Thank you so much. Thank you, Mary.